Hello, and welcome to Pharmside Chat with Pitt Pharmacy. I'm your host, Aaron David-Nathan, and I had the privilege of sitting down with one of our distinguished faculty researchers, Dr. Philip Empey. We spoke about his clinical and translational research and how he is optimizing medication use with pharmacogenomics. In our conversation, we learned a lot about how Pitt Pharmacy prioritizes impactful research that transforms patient care. So let's get started. Phil, thank you so much for being here with us. We appreciate it.
Thank you. Happy to be here.
So we know you do a lot of impactful research with pharmacogenomics. Maybe to orient the audience, could you define pharmacogenomics for us?
Sure. Pharmacogenomics is the study how differences in DNA affect how we respond to medications. So the changes that you may experience with one patient having a great treatment effect and others perhaps an unexpected, the drug doesn't work or may have a side effect, actually for some medications can be driven by differences in our DNA.
Now with pharmacogenomics, we hear a lot about precision medicine. What does that mean and how does that work with pharmacogenomics in practice?
Sure. Precision medicine is really a contemporary term for personalizing care or individualizing treatment. Rather than one-size-fits-all medicine where everybody gets the same treatment or the same prescription, and then we go through trial and error to determine what's the best choice for that particular patient. In this case, we're going to look at all the different variables, genomics, other biomarkers to try to predict and pick the best medication from the beginning. We've been doing really precision medicine for years, but most recently we have a lot better tools and new things we can measure to help us predict better.
So with pharmacogenomics, it's been done for a long time, as you mentioned. What drew you to pharmacogenomics? What was the scientific question that was the allure for you?
Yeah, I'm a pharmacist by training, as you know,
Right.
in taking care of patients, and this was a little while ago. I recognized that some patients, when we picked a particular medication or dose, would respond exactly the way you might expect, whereas the next patient wouldn't get the treatment response you would expect, or maybe even have a toxicity. And it makes you think, why? What's different about that patient, or with a patient that actually has a good result? So if you think about that, it draws you to a bunch of research questions and thinking about what are the drivers. But more specifically, our first implementation here at University of Pittsburgh and at UPMC was thinking about it in a very specific situation. Patients that come in who receive a cardiac stent or percutaneous coronary intervention, if they have a heart attack or need one of their vessels opened up, receive a medication that is used to keep that stent open for a year after therapy. One of those medications, a more commonly used one, is called clopidogrel or Plavix. And interestingly, about a third of patients don't have the expected response to the medication. Plavix is a medication that needs to be activated, what's called a prodrug. So your body, when you take it, turns it on, and it does what it's supposed to do in the body and prevents that stent from clotting off. So it works well in the majority of people. For about a third of patients, though, have very low or no enzyme activity for that pathway that activates the medicine. So it's called cytochrome P450 2C19.
Right.
And with genetics, we can identify those patients up front. And rather than a patient taking a medication that may not work and people don't really know until they have another really serious event, a heart attack or stroke or even worse, we can predict whether that medication may be efficacious at the beginning. And if it looks like it's not the best drug for the patient, choose an alternative that would be expected to have better outcomes.
So you talked about clopidogrel for a cardiac stent. Now that seems like it's obviously very important because time is of the essence and making sure that we have the right dose and the right medication is key. If you imagine a healthcare system in the future, how do you see this being scaled up even more, maybe with other disease states and other patient-specific data that can be incorporated alongside genomics for optimizing patient care as well?
Yeah, it's a great question. I think as we move forward, we'll have a lot more data sources available to us. That could be really precise data from prior medication histories or medical histories and electronic health record. It could be more genomics data. It could be more biomarker data, or even information from things like wearables. Together, all that information can be brought together to make better treatment decisions.
Right.
So clopidogrel is a great example. It's a simple one, and one that I mentioned we first started with, but that was honestly over a decade ago. It's now routine standard of care at our flagship hospital here at UPMC, but there's a lot of other opportunities, not for every medication, but for many medications. We are learning more about how they're processed in the body, and therefore, if we're able to understand those processes and even measure them before you even start the medication, then we can make better treatment decisions. A lot of patients have great responses to medications, but not everyone. And increasingly, I believe we'll have the tools to make better decisions up front and then to refine those decisions. It's more taking, like I said, the trial and error approach into more precision health. And I think there's a variety of disease states. There's well over 100 medications that have the highest level guidance, where we know pharmacogenomics matters for how a drug is processed or how a drug works. So whenever we have that data, we should be using it to guide our decisions.
Now, when we have all those sources of data, in the world of increased data science, AI, machine learning, modeling, how do you incorporate all of these different data, and how has that affected the conduct of pharmacogenomics research in particular?
Yeah, I think it's been transformative. Certainly the emergence of AI gives us greater tools to interpret or even communicate with patients about what these data may mean for their care. But really it's about an explosion in access to data. Increasingly, we have more and more data that's structured appropriately in electronic health records. We're collecting data, daily on our phones, on our wearables, and we're able to measure things much more precisely. I think, people always ask, well, aren't we always doing individualized medicine? And of course, we always were. But the new change here is about new tools to be able to enhance that decision making. And I think, especially with AI and good data science that kind of go together, machine learning, we'll be able to integrate more variables. And rather than being this one gene affects one drug, I think we'll be able to bring in more genes in the pathway, expression data, drug interactions, food, diet, disease, all at the same time. And just like we have great ideas and vision for helping us diagnose conditions in broader medicine, I think especially in choosing the right therapies at the right dose and at the right time for individual patients, I think will be the transformative change.
I think with that transformative change, the key thing, as you mentioned earlier, was that collaboration with the hospital system, with UPMC. As you were pursuing this area of research, what collaborations in particular have been really valuable for your research? Because I would imagine that without the partnership that you have with UPMC, a lot of this implementation really can't be done.
Yeah, certainly partner connections, whether it be in pharmacies, in large academic health systems like UPMC, but even more importantly with individual expert groups. It takes a village. It takes a very large team. It takes a lot of folks getting together and thinking about multidisciplinary research to be able to implement. So we work daily with other scientists and other disciplines, with physicians, advanced practice practitioners of all types, medical geneticists, genetic counselors, nurses, informaticians, scientists in the lab. And really all those expertise need to come together in order to get that good decision. It could be precisely measuring and accurately measuring something in the lab to communicating with the patient and what it means. These really bring together the true learning health system and the multidisciplinary teams. And the other plug I want to do, and we're a school of pharmacy, and the importance of trainees, obviously at all levels, is really paramount too.
Right.
There's really an enthusiasm for learning here at Pitt, and I think because of that, I love interacting with trainees at all levels and new partners that have common interests. We've found that in UPMC so far, but we're working with many others, both locally and nationally, wherever there is a good research question and the opportunity to implement in advanced care.
So Phil, you've talked a little bit about what you've done and how you've come to this point, as well as sort of what we envision the healthcare system in the future. Where do you see sort of your research endeavors in the future? Where do you see the pathway that might go?
Yeah, it's a good question. The field's moving so quickly. First of all, it's not just me. We have a great group in our center, and at the university and beyond, that's all working together to sort of advance the field. I'm really bullish on sort of the opportunities for AI and data science you mentioned, but more doing things at larger population scale, especially involving the patient. We have a couple active clinical trials now, and it's really exciting to work with patients who may have experiences that they're looking for answers for and are passionate about driving their own health. So I see the future as being very patient-centric, managing their own data, and then systems around them to be able to bring them into research, connect with them, be able to answer the bigger research questions and improve the health for not only individuals, but the populations, and leverage all these really cool tools and new technologies we have to advance health.
Yeah, no, I think that's great. That'd be really cool to see how it sort of evolves over the future, given its big evolution thus far.
Lots of exciting things going on, and lots happening at the School of Pharmacy and the University of Pittsburgh and our region.
Awesome. Well, thank you, Phil, for talking with us. It's really cool to hear more about your impactful research. So we appreciate it.
Thanks for having me.
Absolutely. And thank you all for joining us for this conversation with Dr. Phil Empey. We hope you found it insightful to learn about how Pitt Pharmacy performs impactful research that transforms patient care. If you enjoyed this conversation and want to see more, please like and subscribe so you won't miss out on how Pitt Pharmacy improves the health and well-being around us. Until next time, thanks for watching. Hail to Pitt.